We acknowledge the traditional owners of the land on which we live and work. We pay our respects to their elders past, present and emerging. In recent years, Victoria has been presented with the escalating issue of suicide rates among Indigenous and Torres Strait Islander teens, specifically in regional areas. We are diving into some of the possible reasons for these heightened rates and exploring the historical and sociological context of this contemporary consequence. Despite this, there are many Aboriginal and Torres Strait Islander-led interventions to address the urgent need of support, such as the Macabeo District Aboriginal Service, which is used to press the issue of Indigenous suicide rates in Victoria. Moreover, it is discussed if this program is ultimately successful in the reduction of rates or unsuccessful as an Aboriginal-led health organisation.
The health issue we have chosen is suicide, with a specific demographic target on youth. We have chosen this health issue because the number of young Indigenous children that were ending their lives was devastating. Diving deeper into why these numbers were so high, Dr. Hannah McGlade-Curtin exposes 8 issues behind Indigenous youth suicide, all of them relating back to this connection of culture as an ongoing impact of colonisation and racial discrimination from non-Indigenous Australians. Aboriginal and Torres Strait Islander peoples have a holistic healthcare, which includes all aspects of well-being, physical, emotional, social, and cultural. It focuses on individuals being the best versions of themselves and therefore achieving well-being of the community as a whole. However, if Indigenous individuals feel disconnected to all aspects of well-being, this can have a vast impact on what we call the mental health, which directly leads to suicide.
A report from the Coroner's Court of Victoria reveals a distressing 75% increase in suicides among Aboriginal and Torres Strait Islander people in 2021. In Victoria, Aboriginal and Torres Strait Islander people experience suicide rate 3.5 times higher than the non-Indigenous population and tend to be in a younger age group or teenagers. The higher occurrence of suicide is located in regional area around 52.8%, and it is higher rates among males 66.3% compared to females, which is 33.7%. On the other hand, there was a slight decline in suicides among Aboriginal and Torres Strait Islander people in 2022. There were 18 suicides among Aboriginal and Torres Strait Islander people in Victoria, a decrease from 34 in 2021. However, when considering the long-term data, the rate remains troubling. This represents a rate of approximately 27.4 suicides per 100,000 for Aboriginal and Torres Strait Islander people, compared to 10.6 per 100,000 for non-Indigenous people.
The First Nations endured a significant amount of abuse and dehumanization ever since Australia was declared terra nullius in the 1770s. Dispossession from their native land, forced child removal, and institutional racism in society negatively impact both their physical and mental well-being. The trauma caused from these major events were passed down onto the next generations with adverse mental health effects, also known as intergenerational trauma. Racism is a big factor in the socio-economic outcomes of Indigenous Australians. Through racism, Indigenous peoples have historically been excluded from public spaces, accessing healthcare, and denied from economic opportunities, which explains their increased risks to diseases, lower life expectancy, and lower socio-economic status in comparison with non-Indigenous Australians. Because of this trauma and racism in society, the development of mental health conditions has become more and more common in Aboriginal and Torres Strait Islander communities, and depression being one of the mental health effects that they face in everyday life as a consequence of these inequalities.
It is important to assess and recognize what works and what does not work when trying to create a better life with less disadvantages for Aboriginal and Torres Strait Islander peoples. In the past, Closing the Gap reports had been tabled in the Australian Parliament to try bringing equality for Indigenous communities. However, this report did not make any progress in reducing the gap. This was because they were elaborated by non-Indigenous people, and therefore the goals did not reflect what Aboriginal and Torres Strait Islander peoples needed. This example was a lesson learned about how to move forward with Indigenous communities in order for them to thrive. The lesson was easy: Aboriginal health in Aboriginal hands. This basically means that Aboriginal peoples know better than anyone what the communities need to slowly heal from the impacts of colonisation. This is why it is important that Aboriginal-led organisations are put in place in order to make progress. They are able to create a culturally safe space where the patients feel welcome and can rebuild the trust in hospitals, hopefully improving the overall well-being of Indigenous communities.
The Mental Health Demonstration Project in Mildura is one example of a successful ATRO that works for suicide prevention and mental health support in Victoria. The project is led by Mali District Aboriginal Service in partnership with the Mildura-based Hospital Mental Health Services. They aim to improve mental health care for Aboriginal people by adopting an integrated approach. The project combines different mental health service organizations to enhance engagement and improve health outcomes for the target group. It offers culturally safe mental health services, particularly for individuals who may have been hesitant to access mainstream services, including those criminal justice system involvement. With a recovery-focused and strength-based approach, the project helps clients identify goals for their social and emotional recovery. The team includes qualified Aboriginal staff members and support workers. The initiative aims to create a more inclusive and effective mental health care system that provides culturally appropriate support for Aboriginal people.
The Mental Health Demonstration Project by MDAS is deemed to be successful as it is an Aboriginal community-controlled health organisation. Organisations such as this should be prioritised when wanting to gain the most beneficial health outcomes for Aboriginal and Torres Strait Islander peoples. Showcased in NATRO 2022, the biggest consideration as to why these organisations are proven to be the most effective is due to the effect of Aboriginal health in Aboriginal hands. But broken down, there are many reasons why this particular program is successful. This mental health program is successful as having Aboriginal staff and support workers creates cultural responsiveness and cultural safety for Indigenous peoples who feel unwelcome to other mental health services. In addition, with this program being Aboriginal-led, it allows for cultural understanding, where the staff can effectively communicate and understand their patients as well as respecting dynamic Indigenous values, beliefs and customs. Aboriginal and Torres Strait Islander health workers have a deeper connection and understanding to the historical and current trauma of Indigenous peoples. And a deeper understanding is what can allow for personal connection. They see more effective mental health treatment and improve suicide outcomes.
In a nutshell, young Aboriginal and Torres Strait Islander peoples are at high risk of developing mental illnesses leading to suicide due to the effects of intergenerational trauma as a cause of colonisation, with a huge 75% increase of suicide in Indigenous peoples recorded in 2021. Majority are in the younger age groups and in regional Victoria. In order to improve these statistics, it has been proven that Aboriginal-led healthcare facilities are the most effective for treating Indigenous patients. With their holistic approach to social and emotional recovery, Australian community-controlled health organisations, or ATROs, such as the MDAS, are able to provide safe and effective mental health support for Indigenous Australians of all ages.